Good morning, dear students. I'm Bharti Kathuria Sehgal from the SD Vidya School. Today we are going to revise the topic population explosion and birth control. When India became an independent country in 1947, India was an underdeveloped country with its population having no access to good medical care. Life expectancy was very low, as much as 32, and infant mortality rate was as high as 180 births per thousand. However, living conditions improved as the government built hospitals, educated people about health related issues, and conducted immunization programs. These steps increased the life expectancy and also decreased maternal death rate and also infant mortality rate. But with the birth rate remaining more or less same, where in a country its population growth is far more than its sustaining capacity. In fact, India's population, which was 350 million at the time of independence, crossed 1 billion mark in the year 2000, making India second most populous country after China. Demographers fear that at this rate, India, if has the current birth rate of 1.7% and it is not lowered, then India's natural resources would be highly strained, depriving many of the basic necessities such as food, clothing, and shelter. To arrest the population growth, the government has raised the legal marriageable age to 18 for females and 21 for males. The government is also using media to create awareness about benefits of having smaller families. Moreover, government agencies are also motivating couples to adopt contraceptive devices to prevent unwanted pregnancies. Contraceptive methods can be broadly classified into natural or traditional methods. Barrier methods, IUCDs, oral contraceptives, injectables, implants, and surgical methods. Natural methods are the oldest form of contraceptives, reducing the chances of sperms fusing with ovums. They are of three types. In periodic abstinence, couples refrain from copulating during the fertile period, which occurs between day 10 and day 17 of the menstrual cycle. This is when the ovulation of release of ovum occurs, which increases the chances of pregnancy. Another natural method is coitus interruptus, also called the withdrawal method. Penis is withdrawn during the coitus before ejaculation of the sperms. Lactational amenorrhea. It is another natural method which works on the principle that lactating mothers do not menstruate for up to 6 months after the parturition. This is because of the hormone which causes milk production. It also suppresses ovulation. Without ovulation, fertilization cannot occur. The hormone is oxytocin, which affects the menstrual cycle. Lactational amenorrhea and other natural methods are safe because no chemical devices or hormones are used, but they are not always successful. Next are the barrier methods. Barrier method makes use of either condoms, diaphragm, or vault, which prevent sperm and ovum from meeting. Condoms are available for both men and women. They are made of rubber or a thin latex sheet. While condoms for males are rolled over the penis, the condoms for females are inserted in the vagina. Condoms in the females, which when are inserted in the vagina, block the entry of sperms into the reproductive tract by covering the cervix. Most couples prefer using condoms because they are cheap, they are easily available, they offer privacy to the user, and they are also effective in protection from the sexually transmitted diseases like AIDS and syphilis. However, condoms are not reusable. So they are used only for one coitus session and a new condom has to be used every time. Condoms can be used by both men and women, but diaphragms, cervical caps, vaults are used only by women. These dome-shaped barriers are made of rubber and are inserted inside the vagina. Another contraceptive efficiency can be increased by applying spermicidal jellies, foams, and creams. That's because these products contain chemicals which kill the sperms or decrease their motility. Another contraceptive device, which is IUCD, commonly called IUDs, are the intrauterine contraceptive devices. These are used by the couples who want to restrict the childbirth or space their children. These IUCDs are inserted by practiced medical practitioners into the vagina. There are different types of IUDs available. These intrauterine devices are presently available as the non-medicated IUDs like lipase loop, copper-releasing IUDs like copper T, and the hormone-releasing IUDs like progesterone and LNG20. IUDs increase the phagocytosis of sperms within the uterus, and the copper ions released suppress the sperm motility and the fertilizing capacity of sperms. On the other hand, the hormone-releasing IUDs, in addition, make the uterus unsuitable for implantation and the cervix hostile to the sperms. IUDs are ideal contraceptives for the females. They are also very useful for the females who want to delay pregnancy or space their children. It is one of the most widely accepted methods of contraception in India. Now next we talk about the oral contraceptives. Oral contraceptives, which are generally called pills, are the small tablets containing small dose of either progestogen or a combination of progestogen and estrogen. Progestogen thickens the cervical mucus, which hinders the sperm motility, while estrogen acts on the pituitary gland and obstructs the production of luteinizing hormone, which controls ovulation. Ideally, a woman should take first pill within her first 5 days after her menstrual period and continue taking it for next 21 days. During the next 7 days in which the woman is not taking the pill, she will experience menstrual cycle. Following this cycle, she needs to start her oral pills again in the same routine. Progestogens alone or in combination with estrogen are also available as injections and implants which are placed under the skin but are effective over longer periods of time as compared to pills. Although there are several other methods available for the females, but for males there are only two methods available, one which we discussed earlier, that is condoms, and the other one is terminal surgical sterilization method called vasectomy. In this case, a tiny part of the vas deferens is cut and tied to the scrotum, making a small incision on the same. In tubectomy, a surgical permanent method for women, part of fallopian tube is cut either through an incision in abdomen or through vagina. Both vasectomy and tubectomy are successful methods of birth control, but they are irreversible and should be adopted only if the couple wishes to have no more children. In addition to the knowledge of these methods that we have discussed here, a couple should seek advice from a medical practitioner regarding the pros and cons of using a contraceptive method, because some contraceptive methods cause side effects such as abdominal pain, nausea, irregular menstrual bleeding, and may even lead to